everyone. Kenny here with Kristen. Welcome to episode 5 of K&K Real Talk. Today we're talking about the diagnostic lap, what to expect, what's happening during a lap. So we're so happy that you're here with us watching. So if you haven't met me yet, my name is Kenny King. I am a health and wellness coach. I do specialize in helping women with reducing endometriosis symptoms naturally. And I'm here with my lovely co-host, Kristen McCroby. Kristen is the Endometriosis and Me founder and advocate. And Kristen, I will let you take it away.
So today we're talking about the diagnostic lab. I know a lot of people wonder how to get diagnosed properly. So the gold standard for diagnosis of endometriosis is via visual inspection from a lab or a laparoscopy, however you'd like to say it. And basically, because there's no non-invasive test for endometriosis, that is the only way to officially diagnose. So endometriosis is a common benign gynecological disorder defined by endometrial glands and stromas outside of the endometrial cavity, so outside of like the uterus. Um, the key is to find a endometriosis specialist that is experienced in surgery so that you know that you're being taken care of properly. You can be diagnosed by a gynecologist, but they do not have the education or experience that a specialist would. So I'm going to read a little bit from this book here, the Stop Endometriosis and Pelvic Pain. This book is excellent for anyone that's looking for something to cover all of endometriosis. This is by Dr. Andrew Cook. So the part that I'm going to read here is endometriosis is not a cancer, because I do know that many women in the group have been asking, like, is it cancer? Is it cancerous? So endometriosis is not a cancer, but it's not a cancer, but a collection of benign tumors. As with all tumors, they remain in the body until they are removed. The only scientifically proven method of removing endometriosis is surgery, and same with diagnosing. If the surgery is done correctly, it is possible to remove all of the endometriosis. The problem is, too often the surgery is done incorrectly. Gynecological cancer surgery is different from routine gynecological surgery. There is a subsequent training and certification process of those surgeons. Endometriosis surgery, which has more in common with cancer surgery than most other types of surgery, and is just as complex. It's a different kind of surgery most gynecologists are trained to perform. It warrants its own subspecialty training and certification. Unfortunately, treating endometriosis and pelvic pain is not recognized as a specialty.
Yeah, and we want all of you to know that we recognize that there are some of you that have already had surgeries, that some of you who want to avoid surgeries, and we really are in support of covering all bases and knowledge and support for you no matter what your health protocol is. But part of the aspect of this that's really important is understanding that just the diagnostic lap by itself is just for a diagnosis, and it's okay if you don't want to do that unless you need surgery. We'll talk a little bit about that decision in a moment, but recognizing that whenever they whenever there is a lap, we talked about this a little bit in a video before, there's ablation, there's extraction, there are different specialties. So I love what you were just reading, Kristen, because it really lets us know that there aren't that, seeing a specialist, seeing somebody that really focuses in this area is gonna give us a better shot than when it's just simply somebody who's like, yeah, we'll go in and we'll just burn it. And sometimes we trust our doctor, and not that they can't be trusted, but we go and have a surgical procedure that isn't set up really for long term, and then we wonder why just a few months later we're in this intense pain again, and then it's back again. So again, we can get more detailed in future episodes, but I just wanted to touch base on that. Today's focus is the diagnostic piece. We're not going to dive into all the other pieces per se. So let's chat a little bit about prepping for surgery. Each surgeon might have you prepare for surgery differently. Usually there is a pre-op appointment before surgery where they do blood work and get you prepared, depending on what all is going to be involved in your surgery. So your instructions will be different based on not only your surgeon, but also the specific procedure that you're going to be having. If you're having anything in addition to a diagnosis, if there's another paired procedure, and the reason I keep bringing that up is because that's what happens with me. So when they're really diagnosing, the procedure is quite minimal, as they're really just going in to take a look. They're going to take a look around and confirm, yes, we see endometriosis. No, we do not. Maybe something else is going on, or maybe it's deeper and we can't see it. That does happen. Please don't get discouraged if you've had a lap and they said, oh, there's no endo here. We've seen women in the group come up and say, I had a lap, they didn't find any endo, but all my symptoms are saying that endo is there. You can still work on your health in a way that supports a body that's with endo in order to reduce or even eliminate your symptoms. So I do suggest that you have a plan in place with your physician beforehand, before the surgery. First of all, you want to be comfortable. If anybody's going to be, making any sort of incisions in your body, you want to be comfortable with that person. You want to trust that person, and you want to have a plan ahead of time. For example, if they're going in specifically and only to diagnose, have a discussion about, okay, well, what happens if you do find endometriosis? Because you can kind of do a 2-in-1. Instead of having to go back through the process, having a plan in place that says, okay, so if you're in there and you see it, let's talk about what we're going to do there. Some surgeons will just do that. They will bring that up. They will talk to you about the treatment plan. And we know that you guys aren't always getting the treatment that you really need here. And that's why we're asking you to be proactive and ask questions and be as involved in your healthcare as you possibly can be. So being really, really clear before a diagnostic procedure about what happens if they do or if they don't find it, that's going to be really helpful and help you be at ease in your treatment protocol and with your surgeon, so that you're in communication. So you want to have that planned on the front end. So let's talk about preparing mentally, because I think some of us don't really talk about this ahead of time. It's common, whether you've had surgery before, or if this is your first surgery, to have some anxiety around it. It's scary. You're going to be under general anesthesia. You're going to be, even though it's a minimally invasive procedure, it's still invasive. So there's no need to put a brave face on here. The best suggestion I can give is to clearly communicate your feelings and concerns. So you have this amazing, beautiful community of endo survivors, endo warriors, endo supporters that you can come to and say, hey guys, I'm nervous. And we see you guys doing that all the time. That's wonderful. So don't be alone in your head when it comes to this place. Don't feel, or I don't want to tell you how to feel, but it's so common to feel anxiety. It's common to be afraid, and it's completely okay if you are. And chances are the staff is quite familiar with nervous patients and can assist you in dealing with your nerves. That happened to me. I was like, man, I know this isn't a big crazy procedure. I mean, I'm not having heart surgery, but I'm nervous. And they were so kind to me. And they said, you know, it's totally normal. But you know, I think at one point they did give me something to calm my nerves. I think it was something I was going to get anyway, but they went ahead and gave it to me a little bit early, so I could already just start kind of calming. So, you know, if you have an excellent surgical staff, they're actually going to be there assisting you in that process. So your family, your friends, anybody that's supportive, give yourself that space to feel nervous. That is completely natural. Another thing in preparing is communicating your needs. So, an example of this is if you know they're going to have a hard time putting an IV in your hand, tell them. Tell them anything that could be pertinent to making your procedure more comfortable. So that kind of comes in line with getting mentally prepared. Just being able to speak for yourself and say, I'm nervous, I'm afraid, I'm concerned about XYZ happening. What would you do in that case? What would you do in this case? You know, or just sharing. Normally they're going to help make you more comfortable and they're going to help you with your needs. Um, so I now know, I didn't know this before, but I now know that if I'm going to have an IV placed, I either need a neonatal needle for here or they need to go in my wrist here. Now, I didn't know that beforehand. So right before surgery, when I'm all nervous, I've got two blown out um, veins, and there's like this, so they can't stop the bleeding in one, and they've been digging around, and you know, and my hands stayed bruised for, I mean, weeks, but I have all this stuff happening. So then they finally had to go in here, and of course this is a thicker place, and so I'm in pain and really uncomfortable, but I'm like, good gracious, like, I don't care what you got to do. Let's just get this part over with. They're trying to help me out. I'm in pain. They're trying to ask me questions, and I'm like having a hard time answering questions because there's this person digging with a needle trying to, you know, get my IV set. And I'm like, can somebody knock me out, please? So, but now I know, you know, it was that little piece was awful. It was nobody's fault. They were giving me excellent care. But now I know that anytime in the future, if I have any sort of surgery ever or need an IV for any reason, I can say, hey, you're going in right here. You need a neonatal or neonatal. You know what I mean? Neonatal needle. That's hilarious. That's like a, that's like a tongue twister. So now I know. So if there's something that you know ahead of time, and if you know you're going to be anxious, you could make yourself a little list of things to tell the nurses on the day, or things to tell the physician, or things to tell them in ahead of time so that you feel comfortable and that your procedure goes more smoothly and you feel better. So communicating those needs is key. Please don't be afraid to do that. So much of your preparation will be preparing for after surgery. That way you can maximize healing and comfort at home. And so we're going to dive into that a little bit more in a moment. But first, Kristen is going to share what's actually going on during surgery.
So I found this great explanation in the Endometriosis, the Expert's Guide to Treat, Manage, and Live Well with Your Symptoms. And this is by the Endometriosis UK. So the section here, laparoscopic surgery for endometriosis always involves a general anesthetic. So you're asleep for the operation. It involves making 2 or more small cuts on the abdomen, usually in the belly button and others surrounding that, depending on what's being done. These cuts are about 5 to 10 millimeters each and are often referred to by the medical team as port sites, because they are used to hold a specific instrument. Firstly, the laparoscope, which is a short instrument with a camera on the end so that the surgeon using to see what's going on inside. Second is a tube that pumps carbon dioxide gas into the abdomen so it inflates to allow room for the surgeon to do their work. There are up to 5 or 6 ports for more complex surgeries, as many different instruments may be used to move, cut, or burn diseased tissue. Depending on what's being done, the images of the laparoscope are shown on a large screen and are magnified, so everyone in the operating theater has a good view of what's going on. Who's in the operating theater? Well, apart from the gynecologist, there will be an anesthesiologist, and then a section of other staff, including several scrub nurses who look after all the instruments, various staff assisting the gynecologist, such as more junior doctors who are specializing in the field and training, as well as doctors assisting the anesthesiologist. Everyone is there to make sure the operation goes as smoothly as possible, and that the woman is treated with the best possible care before, during, and after surgery.
Thank you. Yeah. So that just made me. It reminded me of my anesthesiologist, like, because I think he was one of the ones that I told him that I was a little bit nervous, and he was like, "Oh, don't you worry, like I'm gonna take great care of you." And I think I even told them one of my worst fears was um, I forget what it's called. There's a name for it, but whenever you're under like you're under general anesthesia and all the sleep stuff works and you're paralyzed and all the things, but your pain isn't turned off. So like you can become aware or whatever. And by the way, I don't want to freak you guys out. I'm going to give you a really cool tip here because I saw a movie that is awful. It's a good movie, but it's just terrifying. It's called Awake, and that happens to a person. So anyway, um, so I'm always like, oh my gosh, like that is so terrifying to me. The idea of not being able to scream or move your body. Well, they were so funny because I was telling them, I was like, I know this is silly. I know this is illogical, but it freaks me out. And they were like, oh, trust me, we're watching everything. And I bet you if that was happening to you, your heart rate on that monitor would be through the roof and we would know something was wrong. And I was like, yeah, that makes sense. So that's why it's so key to share your fears, even if they feel silly, because they will give you that little bit of I felt better. Like I was able to go, all right, go ahead, knock me out, it'll be fine. So, which by the way, sorry if you guys can hear that. It's storming at my house, and that makes my dogs a little bit more antsy. So I've got my little one downstairs barking up a storm. So anyway, okay, so let's talk about after surgery. So this is a lot of your prep. A lot of your preparing for your surgery, other than all of the things you go through with your doctor, with your physicians, with your team, and getting yourself ready, you're actually preparing for after surgery so that you can heal. And so this recovery piece is really key. It is different for different women. I made it up in my head like, this is going to be a walk in the park surgery. I'm going to be right back at work. I even told my clients that, like, oh, I'm going to be out just for a little bit. I'll be back in no time. And it's nothing. I kept saying that. It's nothing. And I think it's because I was trying to tell myself that it was nothing. So, which wasn't necessarily the best way to go about it because I really did need some time to heal. And I scheduled myself back at work earlier than I'd anticipated. So, a couple things right out of the gate that you'll notice is things like throat soreness from the tubes. So immediately after, you may want to have whoever's driving you have something to drink in the car. They'll normally give you something to drink before you leave the hospital. I'm pretty sure I drank 2 juice boxes of apple juice back to back, like just like before I didn't even have my eyes open yet. They had to tell me to open my eyes. Like, you try to open your eyes. Apparently I didn't want to wake up. It was a really good nap, I guess. So throat soreness, yeah, you'll be a little bit scratchy, be a little bit sore from that. So you might have some items at home and even in the car that you can have on your way, because I know for a minute I felt like I couldn't swallow, I thought I couldn't breathe, and of course you're breathing, but it feels like that. It feels like you're struggling a little bit, and that's completely normal. And it's so much easier if you have something to drink, or even maybe something that helps you salivate, like a cough drop or a peppermint or something. So soft foods, being prepared with soft foods ahead of time. You could do super nutrient dense foods like bone broth, cooling foods like sherbet. You can be prepared with like smoothies and shakes so that you're not necessarily having to chew a whole lot, and it's really, think easily digestible food, because it is common to experience a little bit of digestive upset or just kind of some funky digestive stuff. So you might not want full solid meals. You might want really soft, easy to digest foods. And movement is really key as well. Whenever they put you under like that, they have to blow you up with gas so that they can like see everything. And all that stuff doesn't come out whenever they close you back up. So it's really common for it to travel in the body. Some women or just anybody out of surgery feel really gassy. They're really, really bloated. And then you might feel it up in your shoulder because it's trying to figure out a place to go. And the more you move, the easier it is for, you know, for the all of that to be released and to get out of your system. So you know, this doesn't have to be like, I'm not saying go run a marathon, that'd be a little bit silly right after surgery. But if you walk down to your mailbox, if you have a mailbox, or if you just walk around the house a little bit, and just move your body some so that that stuff can move and you can experience some relief. If you do experience a lot post-surgery, there are stool softeners and things like that to just help your digestive movement so that you're not also feeling super bloated and, you know, physically uncomfortable and joints in pain and constipated or something like that. So keep that in mind. You might need additional support afterwards. In terms of your body feeling more comfortable, but you're going to feel uncomfortable for a little bit. So things like comfy pajamas can be really, really useful. Really comfy, stretchy clothing. This is key. Let me tell you, this is something that nobody told me. Now that when somebody finally told me about this, it was after I needed it, so I didn't end up getting one. But when somebody finally told me about this, I was like, duh. So you might have seen this before, but a cough pillow after surgery, especially surgery down in this region. If you laugh, if you cough, if you sneeze, it can be brutal. I got so mad at my husband for making me laugh. And if you get a small pillow, not like these, not like a throw pillow, those are too big. You need a small pillow that's pretty compact. And what happens is if you're about to sneeze, if you're about to cough, if you need to laugh, you press that pillow low against your abdomen and it holds everything steady, so that you can do that with less pain. Because that for me was torture. So yeah, sneezing, laughing, coughing, use a cough pillow. If you don't have one and you just have any pillow at all, use any pillow, but bundle it up as small and compact as possible. I do know some women use, man, what do you call those things? It's not really a girdle, but it's kind of like a girdle where it's very firm support around your abdomen and lower abdomen. That could be really useful as well. Just make sure that when you're using that kind of support that you are also allowing your abs to engage, because you've got some wounds down there and you do want to really let that, you know, let it heal. So, and then I'm going to make a suggestion that might be a little bit unconventional, and that's a journal. You know, if you're having it, mine wasn't just diagnostic. So I elected not to have a diagnostic surgery by itself. I didn't want to be cut into until I needed something else. So it just so happened I had developed a dermoid cyst, and it was reasonably large. It was larger than my ovary. They had to remove the ovary and the cyst. And so when that happened for me, I, again, going back to that, oh, this is a teeny tiny procedure, oh, this is nothing. I didn't exactly give myself the space to have feelings around that. Like I just lost an organ. Like I lost an organ. And I didn't give myself that space. And so I think a journal could be really useful for you to either open it up and just dump everything that's on your brain in it. That's useful for anybody on any day. I don't care who you are. I call it brain dump, like a brain dump. And I use that in a lot of my programming. Um, but you know, sometimes writing out our feelings without judgment, letting ourselves feel mad if we're mad, you know, or sad if we're sad, or sort of going through that process of how you're feeling. If you're mad because you just had surgery and you're concerned about your job, or you're concerned about feeling good enough to go back to work, or you're mad at your surgeon, or you're mad at your spouse, or you're sad, or just whatever it is, giving yourself that space to get the stuff out of your head and onto a piece of paper, and giving you a place to sort of process it, that can be really healing, and at a time when your body's trying to heal. And so my last little piece about this is giving yourself time to heal. I went back to work. It wasn't even 2 weeks. And some women talk about that and they felt great and they were fine. And I don't think I really acknowledged. We got Kristen back. I don't think we really, I didn't really acknowledge, you know, the magnitude of what it was for me. It's different for different people. And so I went to work, and fortunately I sit and I talk to clients, and sometimes it's virtual, but this happened to be in an office, and I ended up like, I was in a lot of pain. So I ended up laying back and propping my feet up, and my clients are the most amazing people on the planet. So it was fine. But I was trying to get my body to just like, okay, just heal already. I got shit to do. And that, you get to be Wonder Woman and magnificent and have space to heal. You get both. So it doesn't mean if you need 3 weeks, 4 weeks of rest and recovery, it doesn't mean that you're weak or that you're not able to go do all the things and take care of what you want to take care of. It just means we get that space. And I didn't exactly give myself that space in the beginning, and I'm a very active person, so I got really frustrated when I started trying to work out again. So healing is a process. It's a process, and it can be frustrating when you want to go work out, when you want to go do something, when you want to be intimate with your partner and you feel like you can't yet. That can be really frustrating, and man, do we get it. So that's where that, you know, giving yourself that time to journal a little bit, that's where giving yourself that space to just heal and recognize that healing is a process. Everybody's body does it a little bit differently. And it will heal faster the more love and support we give our bodies. So nourishing our bodies well, moving our body in whatever capacity that it can move, and that's good for our body, because there's different things that are better for different bodies. And then and giving yourself that time to heal. And so that's really important.
Woman.
We both, now mine's barking. We both have dogs barking. So funny. So anyway, I don't want to go way down a rabbit hole on that, but giving yourself that space is so crucial. You need nourishment, you need time, you need support, and who better to give you the love and support than you need than you. So, so we covered how to prepare for before, what's happening during a lab, and then how to recover and give yourself that space to recover. And so you want to have some of those recovery items in place for you before your procedure, so that you're sort of set up, whether it's like, I have 3 books to read and I'm going to Netflix it, whatever your plan is, have that set up for yourself in place for you, and then give yourself that space so that you can do that. So yeah, I'm sure, we so appreciate all of your patience as we're getting on a roll with bringing these topics to you each week. And every time we show up, we might miss a piece or add a piece that you haven't heard of before. And we just love that you're on this journey with us. And please, as always, reach out to us if you have questions, concerns, topics that you'd like for us to cover. You can find Kristen at the Endometriosis and Me page, as well as the Endometriosis and Me group. And then, of course, the Endometriosis and Me website. That is the right name for the website, right, Kristen?
Yep, .com.
Yeah, so the endometriosisandme.com. So there's plenty of places to reach out to her and to make sure that your concerns or your topics are received. And then you can also, I run a closed group in cooperation with Kristen's groups, and it's called Endometriosis Nourish, Flourish, Thrive. And we focus in that group on healing your body from the inside out and finding natural drug-free support for your symptoms. So reach out to us if you need us. We are here for you, and we're going to see you every week. We'll keep coming at you with new episodes and new topics. So don't be a stranger and don't be afraid to reach out. You guys have a wonderful week. Bye, guys.
Bye.
Oh. How do I stop? Okay, here we go. Okay, officially bye, guys.